Hello, everybody, and welcome. I think we're letting people into the webinar room. We've now just started today's webinar from the UNESCO Institute for Lifelong Learning. My name is Marie Macaulay, and I'm based at the UNESCO Institute for Lifelong Learning in Hamburg, Germany. Thank you very much for being here, and welcome to today's second webinar of the three-part webinar series, which will last until November this year, on the topic of lifelong learning for health, enacting the Yeonsu Declaration for UNESCO Learning Cities, which is being organized by UIL, as well as by the UNESCO Chair for Global Health and Education. And so for those of you who had joined us back in June, welcome back to today's webinar. And for those of you who were unable to join us for this first webinar, we're happy to make the recording of this particular first webinar available, which you can watch later on, and you can find it on our website, which we're posting a link to now in the chat. Today's webinar is titled Spaces, Institutions, and Actors Towards a Health Learning Pathway for All. And it will build upon the first webinar, which we held in June, which was focused on conceptualizing, on raising awareness, and on developing policies for lifelong learning for health at the local level. This particular first webinar was conceptual in nature and focused on policy development for this sphere of lifelong learning for health. And today's webinar, we're moving into a more action-oriented and practical step, and we'll be seeking to provide cities with some support in creating and building a health learning pathway for all. To make the webinar as interactive as possible, similar to last time around, we'll be using the digital platform called WooClap. This enables us to ask some questions to the audience, and all of you can respond using your digital devices, and we will display the responses on the screen anonymously. And to do that, I'll be inviting you in just a second to download it onto your phone or laptops using the QR code I'm about to show now on my screen. I'll just give everybody a few seconds to scan this particular QR code. And that way you'll be able to access the different questions. If you're having some issues with this, I believe we'll be posting also an address to the WooClap platform into the I will just keep this up on the screen for a second while I just let you know a little bit about the logistics of today's webinar. So today we'll be in this webinar for an hour and a half, and we are providing webinar into two different languages, so English and Spanish. You can select your preferred language by clicking on the interpretation symbol at the bottom of your screen, and you can click either on English or Spanish. You only want to hear the interpreted language, then you click on mute original audio to make sure you don't have the voice of the speaker in the background. Just note that the audience is muted, so we invite you to use the chat to greet each other and the Q&A if you wish to ask questions during the different speakers' interventions. The webinar is being recorded, and the recording will be available later on the UIL and YouTube channel page, and a link will be shared in the chat for this as well. We will be doing individual presentations today by the city of Bogota in Colombia, by the city of Chengdu in the People's Republic of China. We'll be hearing also experiences from Cork in the Republic of Ireland, and we will be hearing a presentation by our keynote speaker today, Mr. Didier Jourdan. And again, for all of these presentations, we invite you to interact as much as possible using the Q&A, which we will take questions from during the Q&A session together after we've heard from all of our speakers. So just to give you a little bit of background as well for how this particular webinar is coming about. So in October 2021, we hosted our 5th International Conference on Learning Cities, where we had over 2,000 participants attend the event in the city of Yeonsu in the Republic of Korea. And one of the key outcomes of this conference was the adoption of the Yeonsu Declaration for Learning Cities, which through more than 20 action points affirmed a commitment to lifelong learning for health. And learning cities from around the world endorsed the concrete plan for the development and the implementation of lifelong learning policies, thereby raising awareness and an inspiring action in support of healthy living cities. So this webinar is very much about supporting cities with the enactment of the Yeonsu Declaration, and for which we have the great support of the UNESCO Chair for Global Health Education. And so this particular webinar today sheds some light on the spaces, the actors, and the institutions that are involved in lifelong learning for health and who play an important role in the implementation of lifelong learning for health policy. So as I mentioned just a few minutes ago, this is an action-oriented webinar which takes a technical approach to lifelong learning for health in the context of policy building, and it will feature a task force consisting of 3 of the cities who will present an inventory of their lifelong learning for health policies and practices. And today you'll have the opportunity to listen to specifically 3 concrete city examples, which I just mentioned. So we'll be hearing from, once again, Bogota, Chengdu, and Cork, followed by a keynote speaker. So just to get us warmed up a little bit with the WooClap tool, I would like to ask you maybe a first question to see where you are located. So I think you'll be prompted to answer this question in WooClap, and I think you can choose as many areas as you wish. If I'm not mistaken, that should pop up on the tool. And we have people from all over the world. Oh, that's great. Gives us a nice perspective on where our participants are from today. We have a great representation from around the world. So looking forward to engaging with you later on as we hear from our speakers and the types of questions that you might have with regards to also where you find yourself and how the different technical approaches we'll be mentioning may apply to your context. So thank you for being here. And I think now I'd like to welcome our speakers, Dr. Sara Valencia Cadavid, the Director of the Center for Education and Research in Health and the advisor to the Office of the Secretary of Health in Bogota. Ms. Maudan, the Vice Dean of Huaqiao College, former also Program Specialist for Lifelong Learning at UIL and Program Specialist for Lifelong Learning Research Institution in the Open University of Chengdu. Ms. Rebecca Lachery, Specialist in Social Inclusion with the Health Service Executive and Cork City Council, as well as Mr. Dennis Barrett, Cork Learning City Coordinator for the Cork City Council in Ireland, in the city of Cork, and Mr. Didier Jourdan, the UNESCO Chair for Global Health and Education, head of the WHO Collaborating Center for Research in Education and Health, based in Clermont-Ferrand in France, at the Clermont-Auvergne University. And finally, Mr. Alex Howells, Assistant Program Specialist at the UNESCO Institute for Lifelong Learning, who's also responsible for coordinating some of the efforts we're talking about today. So without further ado, I would like to welcome Dr. Sara Valencia Cadavid to give us her presentation from the city of Bogota in Colombia. The floor is yours, Sara. Thank you.
Well, good morning, everybody. I just want to confirm you can see my full share screen at this time.
It looks great. Thank you very much.
Thank you. So good afternoon and good morning for everybody. In this occasion, I want to share with you what, as a city, we have implemented and to show our commitment with the Yeonsu Declaration for learning cities and for lifelong learning. So my presentation is divided in 5 chapters. For each one, we're going to present how, for each one of the declarations that we think that we have been contributed that are on your left, we have different programs and initiatives in our city that can contribute with this goal. So first of all, in Bogota, we have a public program that is called Production and Use of Knowledge for Health. With this program, we aim to transform the health and well-being of Colombian citizens through education, research, and cooperation in health. In this time, we have $4.7 million to implement these initiatives. So in this, we are showing that in our political investment plan, we are showing political will and funds and our commitment for learning. In this program, we have like different lines. We are funding research on health to produce knowledge that is relevant to our main health challenges. Also, we are creating a policy for research on health that has a strong part for policies on education as well. Also, we are building a health education network for care and well-being with all the actors that produce and have a public offer for educational health. So we are working with universities, with PAHO in Colombia. We are working also with private organizations to create this network. So we integrate all the offer that the city has to the citizens and also for the public and the talent and all health workers. Also, we have Public Observatory of Research on Health, that is the one that you see on your right. So we can see what knowledge is produced on relevant health areas that is also relevant for our political plan. And we use this information to produce some other activities and to produce informs. And also I'm going to present to you finally our art and health program, when we integrate different art expressions to specific learning activities. So other of the activities that we are implementing so far is our model of the healthcare system, a new territorial health model for Bogota. In this case, we are coordinating local plans at different neighborhoods to implement health activities. In this case, we have healthcare teams that go to your house and implement a set of tools and evaluations, and based on that, they direct you to the attention that you need. We have in this part on integration activities, health insurance and provision service. We have Alliance, and it is a really strong program that is taking place here in Bogota. And also we have this alliance between health providers, insurance companies, and the public sector to guarantee health services. So this is called a tripartite alliance, when we have the providers, the insurance, all putting and setting a pool of resources, also economic resources to attend COVID, also for vaccination, attend reproductive health activities. So this is a really coordinated table and working group that is providing essential services for health. And in this context also, we have a strong toolkit that provide education to the health team that goes to homes, but also with the communities that we intervene. So also we have in this case, the school on health, and this aim to empower local people to develop capacities to protect their own health. And we are working with social leaderships, but also we are focusing on young generations, so they can also be empowered and take care of the community of the communities and the people that are in their territories. Usually people that are doing these activities are old, and we want to change and have a new generation. So there are some courses that we are doing on social control, digital literacy, community initiative projects, public policy and participation in health, determinants on health. Also, we have this initiative that are called care promoters. So we are doing some training and taking places like taxis drivers on the places where they work. We are working with motorcycle drivers. We are working with pharmacists. So places where people have it, and shopping centers, and we are training regular people, like normal people like you and me, on how they can be care promoters and help others to take care of themselves, and teach some of the tools that we have here in the Secretariat of Health So we have some learning resources for them. So we, at the COVID crisis, we have COVID care practices. Also, we have care environments actions, guidance on right to health, mental health. So we have first aid courses on mental health, for example, care of the environment and healthy habits for them. So there is a tool that we are working with the citizenships and people at the local areas. And also we have online courses. Also we do interventions in those territories. And also we have participatory activities with them. Also we have our main platform for training on health is this website that is called Aprender Salud. So we have the larger platform for public learning resources on health in Bogota and Colombia. Right now we have 24 closed virtual courses on different areas. These virtual courses open to everybody to access and to look for the information. And we have so far, we have the largest platform and reach more than 2,000 people. Also, this is our program that is called Art and Health. And in this program, we intervene at the communities. Also, we intervene at hospitals, and we are working with people at the individual level, how we can teach them to have better practices on health. And we are going we are implementing activities like simulation in a clinical set to provide better care for the LGBT communities and victims of violence. And also we are going to hospitals where children are hospitalized and teaching to them, the families and the takers, how to improve bad practices and teaching on health. And finally, also, we are promoting health literacy using a website that is Salud Data, and we present all the statistics in our city on health. And also it has a teaching part when people can understand better how to read the data sets and the information that we are presenting, so they can get a better insight of what is happening in terms of health here in the city. So some of the conclusions that we have is we understand that lifelong learning is a pathway that has a lot of complexities in the city of Bogota, but we are addressing needs with different approach. For example, working in the territories with the people and also using our tools to address them. Also, we are teaching at streets, hospitals using multiple platforms and tools. We are strengthening community participation. We are offering health information through tools such as a health observatory. Some of the challenges that we have been facing are some limited economic resources. Although we have a plan, sometimes it is limited for what we really want to achieve at a much larger scope, and also articulation among actors can be also tricky, and people have limited knowledge base on health. So we have to build that knowledge to try to build on that more sophisticated, and they have more tools to make better health decisions. And also what we aim to achieve is an educated citizen making better decisions for their health and well-being in the future and also in the present. So thank you so much for your time and the invitation to share our experience and to learn from experience from other cities in this webinar. Thanks.
Thank you, Sarah, for quite a comprehensive first presentation, giving us some very concrete steps in terms of implementation of the roadmap, but also giving us lots of food for thought in terms of the type of information you're collecting, what you're making available to the different citizens, and the type of participation that is requested also of all the different community actors. So we'll be looking forward to some questions in the Q&A from participants today. Especially I was particularly interested in the topic of data that you're collecting and making that available to citizens. So enhancing that transparency from government to local level communities and participants. So yeah, I'll be interested to hear a little bit more about that later on. I do want to remind everybody here today that we do have the LoopLab tool available with some questions for you to look through and answer. We'll be posting anonymous responses later on to see. For example, we have a question on the spaces and institutions and actors that are playing the most prominent role in your city as you're looking to build a healthy learning pathway. And we welcome your responses. You have two options you can choose from. For your information, the questions are available in 3 languages. So if you just go back into the chat, a comment by Lachery Ivasenko was posted, and you can access the link to the WooClap. If you still need to do that, please do so. We'll be looking forward to seeing what people have to say. With that, I'd like to move to our presentation from the city of Chengdu in the People's Republic of China. So Ms. Mao Dan, I'd like to give you the floor for your presentation. The floor is yours, and if you would like to share your screen, you're welcome to do so as well.
A minute. Can you see my screen?
Yes, perfectly.
Okay. Good morning and good afternoon, dear colleagues. Nice to meet you online. I'm Mao Dan from Chengdu Open University. It's a great honor to be here and share with you about Chengdu's ideas and practices. As the most potential city in the southwest of China and the capital of Sichuan province, Chengdu contains over 20 million permanent residents with nearly 2 trillion GDP last year. After joining ICLC in 2016 and winning the UNESCO Learning City Award in 2019, Chengdu continues to carry out the lifelong learning for health. Since the adoption of Yeonsu Declaration, Chengdu has further enriched the health learning pathways for all. From my point of view, health of the mass consists of 3 aspects: physical health, mental health, and social health. Therefore, health education for all should be carried out systematically throughout the whole life cycle of every citizen in varied forms and in everywhere of the city. Thus, Chengdu implemented a series of policies and initiatives on lifelong learning for health in formal, non-formal, and informal learning spaces. They're mainly reflected in the following 3 aspects. First, integrate health learning resources based on the community learning support network. Relying on the 4-level learning support network for citizens, Chengdu integrates health education into family education, women education, and senior education, mobilizes medical schools, primary and secondary schools, and other educational institutions to be engaged in lifelong learning for health. For instance, community colleges, schools, and hospitals jointly provide health course to students, families during the pandemic. I'm sorry. And the Open University for the elderly, hospitals, and the communities jointly organize health education programs on themes such as World Alzheimer's Day. Schools set up health learning centers. 70% of primary and secondary schools are equipped with healthcare teachers, and the figure is expected to rise to 90% by 2030. And also health tool around Chengdu. These activities carries out activities such as public service announcement, health lecture and consultations, and live broadcasts. With the support of public transportation systems, radio and TV systems, telecom operators, new medias, and communities. Here you can see some examples, what we published and announced. And also, secondly, we reinforce intersectoral collaboration to improve citizens' health literacy level. The municipal health and education authorities have launched the Special Action for Health Literacy. And also the Health Promotion Project Fund was established. with the goal to raise the health literacy level of all citizens to at least 30%. And we also implement the strategy of integration health into all policies. The government and the relevant departments are formulating public policies that are conducive to the health of the population. And we also established a leadership coordination mechanism with measure as the core and various relevant departments as members. Also, we implement this national health sales program and establish standardized model health scenarios of communities, families, schools, and enterprises. And we always focus on the empower vulnerable populations and promote social equity. For instance, on-campus health education posters and the courses are offered to school-age minors, and special lectures on healthcare and anti-fraud aimed at the elderly, and also the door-to-door health action for the disabled elderly, and the rehabilitation training for the disabled and their families. Also, trade unions launched occupational disease prevention programs, etc. And thirdly, we created the multifaceted smart service spaces and enrich the pathway for health education. Here, I would like to share two cases with you. The first one is the Internet of Thing-based service and early warning platform for health. Chengdu Medical College has built a data platform that features the smart elderly care, which integrates and connects medical institutions, community elderly care institutions, and families to provide seniors with one-stop online and on-site services, encompassing physical examination, medical treatment, elderly care, and health education. You can see some of the photos. And also the second case here I would like to share is the Smart Fitness Greenway. Jointly constructed by sports, health, and education departments, the Smart Fitness Greenway, available both online and on-site, citizens can take physical fitness tests while exercising and obtain fitness knowledge, fitness evaluation, and also personalized coaching programs through the Smart Greenway Fitness mobile app. Exercise points can also be traded in for fitness courses so as to encourage citizens to maintain a sustainable and healthy lifestyle. And during the course of establishing the health learning pathway for all, the main challenge we are facing is incapable monitoring and evaluation. Currently, Chengdu has launched a public health literacy assessment yearly in the form of questionnaires. Obviously, it's not enough. What we are expecting is to build up a pilot health influence assessment system, combining physical health knowledge, as well as indicators related to health development of society and the city. And finally, we plan for the outcomes and the objectives. We plan to implement the Health Chengdu initiative and to build up a comprehensive smart healthcare system for all, and to make Chengdu a greener, healthier, and more resilient park city and learning city. Well, that's all I want to share with you on behalf of Chengdu. Thank you very much. Thank you.
Thank you so much, Maodan, for yet another comprehensive but also quite different presentation. I think we're finding a few themes that are coming up. I think especially how health learning pathways are becoming maybe more intersectoral. We talked about the arts with Bogota. You mentioned family learning. You also mentioned technology. We'll be interested to hear later on how do cities establish these collaborative approaches across sectors, in addition to, of course, working with the health and education sectors as the main ones. So with that, I'd like to move to our presentations from our Learning City of Cork, starting with, I believe, Miss Rebecca Lachery. The floor is yours, Rebecca, if you're here. Otherwise, I'll leave the floor open to Dennis. I see that you're here as well.
Thanks, Marie. Thanks, everybody. Good day, good morning, and good evening. It's a real pleasure for us to join with you today to exchange our perspectives and also to hear and learn from yours. So I'm going to share my screen. I will introduce the presentation and then I will hand over to my colleague. She's one of the leading lights in learning for health and well-being in the city. Can I just check that you can see my screen okay?
It's actually, it's gray on my side. Let's try that again, maybe.
I'll try that again, yeah.
I'll be happy to put it up if it, perfect. It's looking a lot better now.
Yeah, did that work?
Yes, if you could just make it full screen and then I think we're settled. That's all good.
Excellent. Okay, so with your permission, I will introduce the topic and then I will hand over to my colleague, Rebecca Lachery. And Rebecca has a really unique role in Cork City, and I'll ask Rebecca to share that with you. In exchanging our perspectives, it's important to reflect that Cork, as well as a UNESCO Learning City member and an award winner since 2015, is a WHO Healthy City since 2012, WHO Age Friendly City since 2019. It received the honour of being EU Capital of Culture in 2005, a member of the Rainbow Cities Network since 2020. We are working to become a sanctuary city and a trauma-informed city. All of these efforts, it's important to note, we don't see them as being separate. We try to work with them holistically. And our reflection on the topic and theme for today, looking at a multi-sectoral approach to lifelong learning for health, it really reflects our efforts as a city over many years. In our Learning City efforts, we have 4 strategic partners, but significantly I want to focus on the strategic partner that we have, which is our health service executive in the country, and that is the Cork Kerry Community Healthcare. All of our thinking on these practices is based on the outcome document for the International Conference on Learning Cities in 2017. And that gave us really a good framework for this multi-sectoral approach using the SDGs and calling on our cities to become more green and healthy and more equitable and inclusive. And that brings me to introduce my colleague, Rebecca Lachery, because in her role, she is an embodiment of the city's commitment to doing this. We think of silos when we reflect on all of these programs. We really need to break out of silos and find new innovative ways to work. Our Chief Executive in Cork City Council, Anne Doherty, who herself commenced a career in the Health Service Executive and spoke at the Yeonsu conference in October. She calls on us all the time to be bold and to be innovative. And in creating many of what we do in the city, but also the role that Rebecca occupies, the city demonstrates that. So I'd now like to hand over to my colleague, Rebecca Lachery.
Hello, everyone. Myself and Dennis are sharing an office here today for the purpose of this presentation. Lovely to be here and really honoured to be asked to participate today as well and to share some of our learning from Cork, but also to hear about the learning from other areas as well, which is invaluable and really interesting presentations already. Just, I suppose, from my perspective, my name is Rebecca Lachery. I'm a specialist in social inclusion, and I work in a joint post. It's a shared post between the health services in Cork City and also the local authority, Cork City Council. In many countries, health services are delivered by local authorities, but in Ireland it's different. There are 2 different state agencies. One of the things that led to the formation of my role is that Cork is a small city, And we felt that there was a lot of potential for duplication around health between Cork City Council and the Health Service Executive. So we decided to look at how we would work together, and that was where my role came in. And so I work in a shared post between both organisations, and as part of that I manage the community services in the local authority and also the community services in the health service. And our aim is to be as collaborative as possible and to have joint working and to break down those silos that Dennis described there as well. And I suppose a really important thing for us is to look at the social determinants of health and take a really broad view of health. So health, you know, using the World Health Organization definition, I suppose, where it's not just about the absence of illness, it's about looking at all the things that impact on our health and on health and well-being and keeping people well. And as such then, from the health services perspective in Cork, we were very anxious, I suppose, to become part of the Cork Learning City. And we would have signed up to be a strategic partner in 2017, around the same time that Cork would have hosted the UNESCO conference. And I think some of you might have been at that conference as well, so you'll remember that as well. And I suppose it for some, it might have been unusual to see the health services as a strategic partner there, but we felt it was really important in terms of the connections between health and education and local authorities. So I go on to the next slide there. I suppose our involvement then would have been further strengthened when we were looking at the connections between health and well-being and learning. As many of you will know, in 2020, we during the pandemic, we hosted the UNESCO webinar, The Learning for Wellbeing, and that was in partnership with the city of Osan in the Republic of Korea. And obviously then was the first formal meeting of the cluster of the learning cities for health and well-being. And in that two-day event, we would have focused on, I suppose, presenting and investigating innovative and transferable examples of good practice across the 14 learning cities. The learning then from that webinar was presented in a report which was launched in 2021. There was a number of recommendations in that report, but I just want to focus on two of those for the purpose of this morning and how they relate to Cork. So the first recommendation I just want to talk about, and it's been touched on already today, is around the role of citizens, and I suppose people being active in their health and well-being. And I suppose in Cork, we've always approached learning and health as you know, with almost with a community development approach. So you're empowering people and you're empowering communities to get involved rather than just cold delivery of services. So we have a number of community-based models that have emerged over time, and I just want to flag two of those with you. One is the health action zones. So the background, the health action zones are 20 years old now in Cork, and the background to that was that there was a number of areas of significant disadvantage in the city that were demonstrating really poor outcomes. And from the health services point of view, we felt we needed to look at how we would do something differently there and work with the local authorities, work with the education centre around that. So we developed 4 health action zones. So in each of those target areas, there's a committee of local people, and they're supported by various agencies and initiatives in the area, but they basically determine what approaches they would like to see in relation to health service delivery and keeping well in their communities. And you can see there's some examples there of different walking groups and music groups, and a lot of the, to go back to what I said a while ago, a lot of it is around keeping people well and informing and supporting people to be empowered around their own health. So it's not just a delivery of a specific health service, it's a broad remit there as well. The next one I just want to focus on then is an example of good practice that we've developed with Cork City Council, and this is around, I suppose, building health learning pathways to well-being. So we've done 2 things here. There's a range of health-related initiatives and community health and education initiatives across the city. So what we wanted to do was support them to work closely together, to be aware of what was there, to work collaboratively, and to avoid duplication. So we have supported the development of a citywide network which is focused on initiatives promoting health and well-being. And then also we've put on our Cork City Council website, which you can have a look at, I suppose, information on all the different local projects. So people have a one-stop shop, if you like, to link with there and to get information. The other recommendation I wanted to focus on coming out of the webinar is around, I suppose, integrated and cross-sectoral approaches. And again, I suppose we want to focus on one particular model that we've developed in Cork, and our theme always behind this is that no one sector can do it alone, and we have to work in a collaborative way. So I'll just go on to the next slide, and what I wanted to talk about was our the Cork City community response to the COVID pandemic. So what we did here was we, I suppose, got everyone into the room, similar to many other cities, I'm sure, got everyone into the room, all the agencies, all the key players in the communities, to look at how we would support the city to respond to COVID. And I suppose our view was it wasn't just about a health response, it was the broad gamut of response around, keeping people well and supporting people, particularly the most vulnerable in their communities. So what we did was we set up an interagency cross-sectoral group, really strong group with over 30 people on it. And that focused on providing essential services during the pandemic. We split the city into 16 areas, and in each of those areas we had a community team pulled together from local people, from local community and organisations, from agencies like the Guards and the health services, and they supported those areas. One of the things we always said was that couldn't have happened overnight. It built on existing services and existing strengths that were there. And also, I suppose, really solidified a really strong community approach across the city. Since then, that's gone on to I suppose, to be repointed to support the Ukrainian crisis. So we have significant numbers of Ukrainian arrivals into the city, and the Cork City community response is supporting the response to those as well. So, and I suppose that's a bit about being flexible and being able to reposition as needed. Just wanted to flag two elements in terms of opportunities for strategic development that we have at the moment. I suppose our learnings from all of what we've done, like we would say, it's really important that they're reflected in strategic development. So at the moment, we're writing a new local and economic community plan for the city, and the work that we've been doing will feed into that, and also into our new city development plan. I go on to and so what we just wanted to say, I suppose, in relation to our existing LECP, local economic and community plan, which is Pure Cork, is that I suppose that at its heart has the commitment for Cork to be a learning city, a healthy city, and an inclusive city. And in the development of the new report, it's really important that that is reflected also, and we're well on the road to doing that as well. And again, it's about bringing that multi-sectoral approach. So I suppose we're in the middle of that process. Our deadline for completing the new report is next June 23, and I suppose we look forward to sharing our progress on that as well. Thanks again for the opportunity to talk to you today. Thank you.
Thanks, Al.
Thank you very much. Thanks for raising also that last point. I think it comes a little bit back to, of course, the intersectorality of the different elements, the different strands, but also it's interesting to hear how the work around health is being integrated into the broader strategic city level plans, such as the new economic plan that Cork is working on. So I think maybe that's a question we can ask our other fellow cities here today, if that's something that's also being developed. But before we get to the Q&A bit, we will move to our keynote presentation from Mr. Didier Jourdan, UNESCO Chair, Global Health and Education, and also the head of the WHO Collaborating Center for Research and Education and Health at the Clermont-Auvergne University. Didier, the floor is yours. Thank you very much.
Thank you very much. I'm more than happy to contribute to this webinar. I'm not sure you're going to learn many things, because after this free presentation, I think that all the different questions linked to the way in which we can build health learning pathway for all has been covered. I just would like to share with you, with a lot of humility, the experience of the different people working within the community of the UNESCO chair, having in mind that what we have in common, and this is also something you said in your presentation, I mean, Dennis and Rebecca, the key issue and the ambition is to empower people. And then to do that, depending on the cities, depending on the context, because when you have a global vision, you can see that this question of literacy, of citizenship for health, are probably organized and understand in very different ways. But the key idea is to empower people and to find a way to create a coherent pathway all over the life. When you have a look on what is done in the different cities, I mean, Bogota, Chengdu, Cork, the city of Clermont-Ferrand, where we are, and also many other cities, I think that we can summarize the principles by this idea of valuing what people are already doing, make it visible, understandable, trying to find coherence, and also trying to fill the gaps. And this is what we learn from the different experiences we hear about in the next minute, in the previous minutes. I just would like to share with you two ideas. The first one is about the way in which we can carrying out the inventory of the existing contribution to lifelong learning for health at the level of the city. And the second one is about the way in which we can structure, organize, build coherence. And what we learn is that there's a strong need for two key things. And this is what we also hear from the cities of Bogota, Chengdu, and Cork. It has to be a city initiative, and also it has to be linked to the genuine participation of the stakeholders. And when you have a look on the different settings, one of the most probably biggest challenge in the aim of building a health learning pathway is to have the schools on board. Since they have a dynamic which is not always in coherence with the city policies. And probably when you analyze the barriers and levers to involve the schools, and I mean primary, secondary, and higher education in the process, the key question is to find something common. We observe, and this is probably something you know in all, because it's the case in every city, you cannot create in collaboration and contribution if you don't consider the problem is common. And then one of the key issues is to find a way to find a common issue to be shared with the school system, and then to be able to find a way to support them in the delivery of health education. And among the solutions, this is something I'm just going to talk about a bit later, the key issue is to help schools to realize that their contribution is more a way to benefit from, I mean, resources and support instead of having new problems, you know, this new layer of program projects at the city level. This is what we observe. Concerning the higher education, and especially the adult education and all the processes, this is clearly in the different cities one of the key actors from the start, since they are very often involved in the city's dynamics. The third actor is the sports club and the associations. You cannot build a health learning pathway without emphasizing and supporting associations and sports club in their educational role. The experience shows that it's easier and easier. This is something we could discuss about, because it probably depends from a city to another. But there's the orientation now of many sports clubs toward the health issues is probably one of the important trend at the time. And this is something that is probably helpful to build a health learning pathway. Concerning the healthcare professional, from a very concrete and operational stuff, when you work with them about the health learning pathway, very often the answer is that we are too busy. It's one more thing. It's too much. It's too much for us. And then you need the kind of organization Sarah talked us before. This is something which is rooted in the policy at the local level. And then the key idea here is probably to find a way to highlight the mission, the educational mission of the healthcare professional through their everyday activity. And this is something you can do through small things, and we have a lot of examples of cities doing that. And we also observe that a lot of cities involve the healthcare, the home and care services, and especially all the services for elderly people, because there is more and more awareness of the role of these services in relationship to the health literacy of elderly people. So having on board all these different actors at the local level is probably the first step in building a health learning pathway, knowing that depending on the context and the cities, you have different barriers and levers. The second thing we learn from the field in a very concrete way is the question of the way in which you can organize, create coherence between all that kind of initiatives. There's a lot of things that are developed in the different countries in relationship to health. How could we make it more coherent and visible, understandable by all the citizens, and especially the most vulnerable of them? To do that, to structure the pathway, and this is also something you talked about in the presentation from Chengdu, Bogota, and Cork, you need, of course, to strengthen the cross-sectoral collaboration, but of course, again, how to do it, how to make it possible. This is also integrating the activities, identifying equity. So to do that, our experience shows that the first step is to make an analysis of the determinant of health of the people at the local level. This is something which is common in many, many cities, especially, of course, the WHO of the cities, but how to build a relevant health pathway if you don't start by the beginning. This is identifying the health determinants and then build on that, knowing that research shows that these determinants depends on the socio-economic condition of the people. And then there's probably a need to have a better understanding of these determinants, especially for the most vulnerable part of the population. So first step is probably to have in common the fact that we start by the health determinants. And then in our experience, the health learning pathway could be based on two different pillars. One is about the skills we would like to contribute to develop within the people and the population in general, the young and the old people, and also the creation of a supportive educational environment for health learning. And this is exactly what has been described by the two cities. It's about the content and it's about the conditions for the people to learn. And we have a lot of examples, but the idea is to have in mind that during all the life, we have the educational contributions of the family, schools, community services, association, and sports club. And probably what also we need to have a sustainable commitment of the different people is to have regular events. And this is, for example, what is done regularly in Cork with the different meetings about lifelong learning. The health learning pathway, this is gathering, putting together the initiatives, and also trying to make it visible and accessible to all the population, especially the most vulnerable. So among the ideas, what we learned from the field is that you can create the condition for intersectoral work if you have something in common. For example, it's working about migrants people. For example, it's building collaboration between school and local healthcare services. We have, for example, also a work, this is an example of the work done by our team with the dentist, with tools for the family and tools for the school. This is creating the conditions for a common learning process for the kids. The second example, this is exactly what has been described by the different cities today, is to make it visible through communication, to make a logo, to be able to help people to understand that they are in a learning process. In times of crisis, it's evident, but also in ordinary time. The third idea we learn from the field is that there's a need to try to reach the people where they are, migrants people, people in very vulnerable population from a socio-economical point of view, old people. And we have in mind the example of the city of Yeonsu, where we were a couple of months ago with the bus going into different neighborhoods and villages and places to work with the old people on the digital literacy. Another entry point, which seemed to be relevant at the city level, is to make all the health checks, all the different kind of regular medical visits to be educational opportunities with a clear framework and tools and resources to help professionals to contribute to the education of people, to have a kind of a special points to move forward. Concerning the schools, again, it's pretty complicated, and some cities are working on resources, and this is the case of different cities in South America, to help and to support schools to contribute to health education in relationship to the health learning pathway. The last example is about the use of the urban design and the mapping of what makes it possible to be healthy. And this is the example of the city of Chengdu with the Greenway, which is digital and which is also a physical way, a physical route that you can design through educational walks in the city. If you want more examples and ideas and suggestions, you can have a look on the enactment guide we wrote and of course contribute to it. The next step is, of course, to work on the way in which we can keep the commitment alive, to give visibility to the pathway and to ensure sustainability. This is something we're going to talk about during the next webinar. And of course, what is critical is to have in mind that building the health learning pathway is a collective endeavor, and that's why the emphasis the 3 cities put on the intersectoral collaboration is absolutely crucial. Over to you.
Thank you so much, Didier. I think everybody would agree with me if they could all speak that you've done such a great job of tying the different elements together from the city's presentations. So maybe before we move into the Q&A right away, I'd like to just prompt the WooClap screen and to see some of the responses we received to the questions. So we asked you which spaces, institutions, or actors are playing the most prominent role in your city as it builds a health learning pathway. You could select 2. So I think we have one clear one here at 51% with 18 people who answered the public health sector. And then we have at 29%, so 10 people answered, and then 26% local NGOs and higher education. I think we can come in, sorry, 23% I see non-formal education. So I think those elements have come across quite clearly in the different presentations. We heard about the role of schools. We heard also about community, local NGOs. We heard about higher education to some extent, and of course, non-formal education. For the rest, I think all of the actors, of course, are valid, but it's great to see how you've kind of determined an order of priority. So maybe we can get back to that a little bit as we go through our Q&A. And then for the next question, we asked you, let's see, we asked you what the greatest challenge was in terms of that your city was facing in setting up a health learning pathway. So for that, we also have some answers from really all different types of options here. So insufficient human resources. I think that's a given. I think that's something Didier also addressed when he talked about specific institutions not having the time or resources to allocate to these efforts. So maybe some of elements of response were made available today through Didier's presentation. We can also get back to that a little bit. Of course, no lifelong learning for health policy as something that might be missing as a main challenge. Lack of public awareness on lifelong learning for health. I think again the role of schools here might be important to consider, and then insufficient funding, and finally, sorry, lack of stakeholder collaboration. I think that was a really interesting aspect of all that really connected the different presentations today. This topic of intersectorality, finding a common denominator to make all the actors involved in the process of creating a lifelong learning for health pathway. As a really interesting tool for moving forward with this enactment of the roadmap. And just maybe we can move to the third question. What kind of support does your city need in building a health learning pathway for all? Let's see. Well, okay, again, we have quite a few responses. And it's really all of them seem to echo here with the participants. So setting up a multi-sectoral lifelong learning for health task force, mobilization of human and financial resources, developing an action plan, integrating contributions from formal, non-formal, and formal learning, and finally building private and public awareness, taking stock of lifelong learning for health policies, initiatives, and practices. Yeah, it seems like the challenges and the support are all very connected. So again, maybe we can hear a little bit about what the participants have to say. Didier, if you want to get us started in terms of the challenges that were identified, the types of stakeholders that need to be brought on board, and some of the support that is needed, how we can maybe bridge those together to foster and help cities in developing these lifelong learning for health pathways. I'll leave it over to you, Didier, and then we'll move to the city examples to see how they've dealt with this.
I think you already say what's important. It's finding common denominator to the different actors, and also it's about capacity building. You know, what we are talking about is something that is part of all the community dynamics. And if we want to have empowered citizens, we need to build capacities, and building capacities make possible to have commitment, involvement of people, and collaboration. Over to you.
Thank you. Maybe we'll move over to Cork for a take on some of the responses here and how you've addressed some of these challenges that were mentioned.
Thanks, Marie. My initial thoughts go back to something we learned along the way when we were developing a playful city policy. So we visited at that time a city in Italy, city of Udine, and they gave us something very, very valuable, the idea of top down, bottom up, and middle out. So in our community response forum, that's reflected. We have a top-down leadership group, and you do need leadership in these efforts. I think all of the cities who presented today showed leadership, and Didier has reflected the need for leadership in his analysis also. So you need leadership at the top, and in our community response forum, we have the head of our police force, the head of our health services, chief executive level at city council, education training boards, universities, etc. And then at community level, we have bottom-up leadership. So those 16 area teams that Rebecca shared with you, each of those area teams has been empowered to act locally. So they have taken leadership locally, and the top-down level supports them in that. And then significantly, the middle out layer, that was the thing we learned in Udine. Those of us who are not at the top of our organizations and aren't working at community level have a significant role to play in coordinating our efforts, particularly to address some of those common challenges that Didier reflected. We identified some during COVID, the need for food supports to go into particularly vulnerable families. We've identified some new ones with our Ukrainian arrivals to the city, where the community and voluntary, the NGOs of the city have played a huge role, and they can be coordinated with that middle out layer. And that middle out layer can address other challenges also, addressing some of those ongoing challenges of inequality in our city. And we all know that inequality doesn't end with income, or it's not just economic, it also spills out into educational inequality. And as Rebecca said, the health action zones addressed health inequalities. So that's something we have learned along the way in Cork, and we work hard at it. I think all of the cities would also share this multi-sectoral thinking and work. It needs ongoing maintenance. Maybe Rebecca might like to add something on that, because the close collaboration in Cork has had that ongoing active maintenance over the years.
Yeah, I think that's probably a key element of it. And I suppose a lot of what Dennis is saying there, I think, is around the importance of allies as well, and having good allies across all of the sectors, and people who you know will buy into what you're doing and will support it. And that's really important, because a lot of this does start as being very subjective before it becomes organizational. And then I think for us as well, it was about being a little bit creative and innovative in how we were approaching things and doing things a little bit differently. But I think, Didier, what you were saying a while ago about, having common, I interpreted it as kind of common goals or areas that are of common interest across a number of sectors, is definitely something that has worked very well for us as well.
Thanks, Marie.
Thanks.
Thank you so much. Maybe Sarah Valencia, if you're still with us, you would like to react to some of the challenges that were identified, some of the support needed from cities. How has Bogota maybe bridged some of those challenges into some opportunities given the experience of the city?
Yes, so at the city level, for example, we have an intersectoral table to work with the different other sectors in the city. So we are working with education, we are working with social integration, we're working with the sports sectors that was mentioned by Didier, that is quite important and relevant right now. So on that table, we also discuss what is necessary to implement in terms of health. And based on that discussions, some agenda is implemented, and resources, not just economical resources, but the people and the network and social capital that is necessary to create and implement the activities is implemented. And that table can dynamize what we are implementing in Bogota. And we address, for example, the determinants of health. And there we see how are the different health aspects affecting our citizens. And on that table, we make the decisions on the environment and also on access to education and what we can do at schools, and also what we can do with women, for example, with migrants. That is one of the challenges that we are facing, and how we can educate our social workers, health workers, people at schools to address this wave that we are facing, how to decrease the discrimination that people is feeling, how to provide head attention to these people, how social integration, for example, can channel the communities that they identify and send them to the emergency. And so that is also a process to coordinate, but also to educate them based on the needs that are identified. And that's something that in our experience has been working. Of course, you also need allies for this process, and you need to build a common agenda. It is quite simple to have individual agendas that crash. So leadership and be able to talk and create a pathway and a clear goal, it's fundamental, that can integrate what people want. And it's just not the public sector. When you work, and I was really surprised that international NGOs received 0 votes in the first part, because in the case of Bogota, for example, we are receiving a lot of international collaboration by the US, by Germany. So how you can coordinate the agendas that they have as international bodies. They have a mandate by their governments to cooperate with the cities, but also they have their own interests. So how you create that dialogue, and they're always very interested in education, how we can reach the communities, how we can reach the social workers, how we reach the health workers to teach what they want to, or to, so it is quite important also the role that they have, and being able to talk, to listen to them, and to create a path. So that's my 2 contributions to the discussion.
Much appreciated, Sarah. Thank you so much. And then maybe before we move to the next question, I'd like to invite Maodan to react to the topic we've been covering so far. Maodan.
Thank you. For the intersectoral mechanisms here in Chengdu, just now I shared this case. We call it that this is a national initiative called Healthy Cells. So for each city, like us Chengdu, we have tried to establish the city as health city. And for all the districts and counties, they also have this target to establish their own area as a health area. And for this initiative, we have policies, we have fundings, and we have goals, and we have very detailed standards and indicators. And for these for each district, and they have these they have their goals to set up to establish health hospitals, health schools, health families, health communities, and for each specific scenario spaces, they have their own detailed indicators and standards, and this is also of very detailed form. And also, as I shared with you, that for these indicators first they included the policies, and we said that we have to implement health into all policies, which means all the sectors, relative sectors and departments. First, they have to go through their own public policies to see if their policies can be contributed to develop the health of their own area. And also, these policy parts will take part about 30% of this indicator, and also the hardwares, like the environment. For example, the hospitals, they have to, the schools, they have to equipped with certain equipment, and also the administrative mechanisms, and also their the way they carry out, how much they were involved in the health education are also in these indicators. So for each department, they got their own specific role in this common goal to establish this health district or health school, health hospital, health community. This is how they work together. And also for this mechanism, all this initiative, the measure for city level is the measure to be responsible for this project, and for the districts and also for the counties, also the head person will be take responsible for this. So he or she has the power to coordinate all the departments, and all these departments have to follow the indicator and to go through their own policies and to work together to achieve this common goal, which is to establish this health district. That's what we do. Yeah.
Thank you so much, Maudan. And this is really quite fascinating how, in fact, for you, the common denominator has been establishing some indicators that everyone is responsible for ensuring that they're set up and being followed across the different sectors. So quite an interesting maybe way of going about it. I see, Didier, you unmuted yourself. Maybe you want to react to this, and then after that, we'll move to the next question.
Yes, this is just to talk about the real life. All of us know that preaching is one thing, practicing is another one. All of us want to build, and this is what we are doing for some of us for many years, to build this intersectoral collaboration. And that's why with the research team, we work for now more than 15 years about the conditions for generating this real, genuine intersectoral collaboration. And what we observed on the field is sometimes this is just what Maudan just said. This is a political initiative. This is a strategy. This is a decision. But in many cases, it's more linked to local, common issues, problems considered as being common. And clearly, the COVID-19 and the health crisis are seen by people as common. Of course, most of the answers are just communication. We're going to tell the people what they have to do. But more and more people realize that lifelong learning is the only key we have in hands to build healthy and resilient cities. So we need to find something, an entry point. So in our experience, we have health crises. It could also be different kind of crises, especially in the global south. This is initiatives from the pharmacists who really want to link with the community because of professional identity issues. The same with the dentist. It's very often around the question linked to migration and the way in which we can welcome the migrants. And this is also something considered as being common. Reduction of inequalities is also sometimes seen as common, and schools too, because there's now more and more involvement of the healthcare sector in schools. So my vision at the time is that the key question is to find the good way of defining a common problem, and then you can build on it. But first of all, to be able to create this intersectoral work, you need to have something common, what you call the common denominator at the beginning. So very different kind of them, local or more national. There's a lot of different situations, but this is the key stuff, something concrete, real for the people.
Thank you, Didier. Thanks for that. I think that's a really great conclusion to this topic of intersectorality, and maybe we segue into the next question. So we talk about the different actors, and one of the questions that comes to us today is around what would be recommended for the youth to start with in building themselves to understand maybe, but also promote health in communities as they share, as this participant points out, a large stake in today's communities as they grow. So maybe we can start with Cork around the involvement of youth in this field, if that's okay, and then we'll move to Sarah.
Thanks, Marie, and thanks for that question. We would share in Cork a commitment and a concern that the voice of young people is so central to how we think and how we plan for the future. We've shared with you some examples of the structures that we've developed in the city, and in each case there's a role for both young people themselves as advocates and also organizations that work with young people. That community level, those structures at community level, at their best, they have youth fora attached to them. And we have some strong youth fora in our city where the youth workers, youth organizations, and young people all come together to share what their concerns are, to take action themselves, but also to raise their concerns, raise their issues, and advocate. So those kind of structures are really important. The citywide organizations then have to link in with those so that those voices don't remain kept locally. I might ask again, Rebecca, in terms of the health action zones, there's been a number of very, very good initiatives involving young people there, or there may be other examples that Rebecca is aware of.
Yeah, and I think as well, it is about, I suppose, everyone's responsibility to make sure that we're involving young people in kind of what we're doing and in the design and delivery of services. And particularly with the health action zones, as I talked about, they would be in areas of significant disadvantage. And I suppose we were very aware that we needed to ensure we were targeting young people that maybe, were not in the formal education system, or maybe in the informal education system, or maybe needed additional supports to engage with the formal education system. So things like local interventions like teen gyms, encouraging people into sporting activities that are very popular in those communities, whether it's basketball or boxing or whatever it is. So it's about maybe meeting young people where they're at as well, and listening to what their interests are, and how they want to get involved in it. We also have a very strong partnership with the Sexual Health Centre in Cork, and that has a specific targeted program around young people, and that's been very successful as well.
Thanks, Marie.
Thank you so much. Thanks. Saha, maybe over to you.
Yes, so I'm going to follow to one of the points that was mentioned before, because we need to understand the dynamics of the young generation. So how they communicate, how they interact, how they understand the society, and how they are engaging with society. So what perhaps we think and was our generation has been changing. The way that they interact with social media, they are working with elder people, with the also children, it's different how we did, and my parents did, and my grandparents did. So first of all, we need to understand their dynamics and understand that we can create some activities to engaging with them, and also we need to make them part of the solution and the activities and what we are doing for education. So if they are part of it, also they are learning tools, they are learning the methodology, they are also participating, and they are feeling that are part of, and being part of is quite important to take part, to raise your voice. So for example, we have an international cooperation with City Rise, that is an alliance between different cities to talk about mental health in young generations. So what we are doing is giving to them tools to create their own campaigns, for example, on mental health, and how they can engage to their own generation, to access to medical services. And they created entirely the campaign that is going to be implemented in the city. So that is an example of how you can give them voice and also visibility, so they can become also leaders in the future in their own communities. So those are kind of my thoughts on this topic.
Thank you, Saha. Maybe I'll give the floor to Maudan just in terms of bringing youth on board with this work, and then we'll move to one more question.
Sorry, would you please be specific? For what question I'm going to answer?
No problem. We were just we're kind of gathering input from cities with regards to the involvement of youth. What can be recommended? What have you already put in place for getting them to promote healthy communities, but also understand their role in building healthy learning pathways at the city level? So what is the youth involvement really in your city for healthy learning pathways?
For youth, nowadays, as you know that for each the primary and secondary schools in China, in Chengdu, we equipped with them with a health center, and also equipped with them with health education teachers. Some of them are full-time, some of them are part-time, and we try to they set up this health education center in order to integrate the internal and external resources, especially for those students on campus. We always invite. We try to train those medical professionals to improve their education skills. We organized the citywide competitions to select and train those medical professionals to improve their. And we have this pool of medical professionals and also those medical institutions like hospitals, and they are also part-time teachers in those primary and middle schools. And so they always organize and carry out different activities, live classes, and also hands-on activities to help those young students. And also for those, we also have this platform. We use this platform to, this is a kind of new media platform. Every parents of the youth are required to install this platform into their cell phone. And through this platform, the community education institutions and professional medical institutions, and also the healthcare departments will directly deliver those healthcare educational materials to the parents of the students, for the young students. It depends on their age. For those younger, they will need their parents to help them to finish those online education materials, go through those online materials, and also they have to finish. They have to watch those videos on their cell phone, and also have to finish the exercises. And for of course, elder students, they have to go through by themselves. This is something we're doing, and also especially during the pandemic, sometimes students are under quarantine. Like now we are all the students now in Chengdu are under quarantine, so more live broadcast courses are delivered to the students.
Thank you, Maudan. Thank you. That's really helpful, and also gives us a great glimpse into all the different activities, initiatives being led by the different cities on this topic. There's so many great questions in the chat and the Q&A. Unfortunately, we don't have much more time to address them. I'd like to invite the speakers today, if they wish to do so, to just respond to some of those questions. If they have some direct examples, they could provide, elements of responses. But before we conclude this webinar, I would like to give the floor now to our final presenter for today, Mr. Alex Howells, who is going to give us a presentation on using the enactment guide. So maybe just again, keeping in mind that we're trying to be more practical today with the work on developing lifelong learning for health policy implementation. So Alex, the floor is yours for today's last presentation.
Thank you, Marie. Thank you for that. And thank you to everybody who has contributed to the webinar today. I would just like to take a few moments to zoom out from the really valuable exchanges we've had in this webinar and situate that within the context of the webinar series, which, as you know, features 3 events. And the series is really part of a big collaborative effort led by the UNESCO Institute for Lifelong Learning with the UNESCO Chair, Global Health and Education, in collaboration with members of the UNESCO Global Network of Learning Cities, but also beyond, including cities that are not currently members of the UNESCO GNLC. But this is a big effort to promote lifelong learning for health and ensure the enactment of the Yeonsu Declaration, which was the outcome document of the 5th International Conference on Learning Cities held last year in Yeonsu. And I'd just like to draw everyone's attention to this guide because it already exists. So a lot of the issues that we've been discussing today, a lot of the challenges that cities are facing, they are detailed in a guide that has been developed for this webinar series, very much led by the UNESCO Chair, Mr. Didier Jourdan, and his team. And I just want to remind everybody that you can already access this guide. So we'll post a link in the chat. We'll make sure that you have that. It's already online. It's a very detailed resource, and it's designed to help you all to promote lifelong learning for health. There are 4 key components, which I'll mention briefly in a moment. But just to say that the first draft has been developed by the UNESCO Chair in collaboration with UIL. But we really want to ensure a process of co-creation with you, with city stakeholders. And I'm going to talk just a little bit about how we intend to do that. But here is the link, and it would be wonderful if perhaps one of my colleagues could just copy and paste this link into the chat now, because this is where you will find the guide. The purpose, as I mentioned, is to support cities involved in the development of lifelong learning for health policies, whatever their context. Important to note that this is an enactment guide, so it's putting all of the commitments that were contained within the Yeonsu Declaration last year into action, and all of those commitments concern issues such as health, learning, resilience, all the issues that we've discussed today. As I mentioned, the first draft is ready and can be consulted, and cities are invited to provide their feedback. So between now and the third webinar, which Marie will talk about in a moment, we're going to really strongly encourage all of you to provide your feedback on the guide and help to ensure a really useful final version of the guide. So as you will see, once you access the enactment guide, there are 4 main components. We have the backdrop, which just gives you a little bit of context about the Yeonsu Declaration and what was contained within the declaration. We have then a lot of information on what could be, what may constitute the content of a lifelong learning for health policy, how that can be actually produced. Then we move to the point of implementation. And section D is, I would say, a really valuable resource. It's a set of tools, very practical tools, on a number of different topics relevant to the issue of lifelong learning for health. And they're quite short, and you can just pick and choose those which perhaps apply to your context. And you are invited to use those tools to support your own initiatives. There's no single method or way to use the guide, so you can either follow it sequentially, or you can jump in at section B or section D. You can go straight to tool 12. It's completely up to you, but we have, or rather Mr. Didier Jourdan and the UNESCO chair have categorized maybe 3 groups of cities. So we have those cities that already have a lifelong learning policy, but perhaps not a learning for health policy. We have cities that are perhaps in the opposite position, whereby there is a strong health policy, but maybe not an established lifelong learning initiative. And then we just generally have those cities that are interested in implementing a specific policy dedicated to lifelong learning for health. So your city may be located within one or several of these groups. And this diagram is featured in the guide, and then you can see it's just really a suggestion as to how you may wish to approach the guide depending on your city's position. So a little bit more about the co-creation process. So you're invited between now and November, if you haven't done so already, to read through the guide, reflect on the content, contextualize it, try using some of the tools, consider some of these questions. You know, is it useful? Which bits are particularly useful? Which bits aren't, perhaps? How does it help? What is perhaps missing that you think could be highly relevant that maybe isn't there right now? And then please visit the following link here, which we have to a survey which we have set up, which I believe one of my colleagues is going to post in the chat. The survey is there. We have a series of questions inviting you to provide your feedback directly on the guide. So then we'll reflect on the feedback between now and November. We'll address some of the points, I think, in November, and this will all lead to a final version of the guide designed to be really useful to you and to support you in clearly all of your efforts to promote lifelong learning for health. So I think with that, I'll just move to a slide on the third webinar and hand back to Marie. Thank you very much.
Thank you very much indeed. I think this is a great way to conclude today's webinar, and I invite you to join the next and final webinar of the 3-part series that started in June. So this webinar will be held on the 16th of November, and we'll be focusing on implementation and visibility. You can see here some of the details listed. So we'll be talking about the implementation of policies in light of some of the varying socioeconomic and cultural contexts. We'll be talking about monitoring and evaluation. And we'll be talking about visibility and sustainability of the policies and practices for implementation. So again, we invite you to provide some of your feedback. You'll receive an email again to register as well. And once again, I'd like to thank the participants for all the questions that you raised a lot of different points that we were not able to cover today as much as we would have liked to. So I think if you wish to integrate some of those elements into your feedback for this enactment, if it fits in that way, please feel free to do so. We'd be really really interested in hearing a little bit more about some of the questions you raised, but also some of your elements and thoughts, elements of response and thoughts you might have on the tool. So with that, I would like to wish you all a good day, afternoon, and evening, and looking forward to seeing you on November 16th. And thank you to all our speakers for some great presentations today. And see you all very soon.